So Delegate Robertson, we have 2183 before us.
Yes, Mr. Chairman, members of the committee, there is a substitute available for this, for House Bill 2183. This is something that's been before us again and again and again. I'm a strong believer, I'm a strong believer that professions should be able to practice to what they've been trained to do. And in this case, trained to do and be able to practice on their own in a timely manner. This is the nurse practitioner bill. In the past, we've included lots of things in this particular piece of legislation, trying to move it forward. But what this piece of legislation does is one thing, and that is taking it from 5 years of the supervision under a physician is to, and to move it down to 2. So the original bill that you received said 0. We knew that that was really unrealistic and came to 2. We think that that's a great compromise, and it positions Virginia with all the other states that, you know, has nurse practitioner. It puts us in the middle of the pack with that. As we all know, healthcare is in need of providers. The study that was done by the health professions showed us a couple years ago that nurse practitioners do go to areas that are underserved. We also know that we're getting the bleed into our surrounding states because they can go to surrounding states and practice much quicker and on their own, and we want to keep these well-trained practitioners in the Commonwealth. I have several people who would like to speak to this bill, but that's what this bill does. You know, in the past, the other pieces that we've had are all being handled somewhere else by someone else, and so this to me is a very small ask to change that language.
Okay, thank you. Anybody here to speak in favor of Delegate Robertson's bill?
Good morning, Mr. Chairman and members of the subcommittee. My name is Alicia Pack. I am a doctor of nursing practice, family nurse practitioner of 15 years, graduate educator, and president-elect for the Virginia Council of Nurse Practitioners. I am speaking on behalf of the Virginia Council of Nurse Practitioners and Advanced Practice Registered Nurses in here to support House Bill 2183, which would allow the transition to practice without the practice agreement. The passage of this bill would allow NPs to once again practice as they did nearly 2.5 years ago during the global pandemic. To this date, there has been no reported negative impact on patient safety, and patient access to care had improved and has improved. In 2020, as a response to COVID, our former governor issued the executive order which allowed NPs with at least 2 years of clinical experience to provide advanced practice nursing without a physician-bound written agreement in the category in which they were certified and licensed. As a physician, the former governor understood the importance of safe and accessible care, and with increased demands bearing down on the Commonwealth's health care at the time, he did not take that decision lightly. Nurse practitioners across the state answered his call and worked tirelessly to prevent the community spread of the disease while continuing to care for their patients in primary and specialty practices. To be clear, we do not want to practice medicine or replace our physician colleagues, as we are not trained as such. We are from 2 foundationally different fields, which help us to create decisions for best outcomes within a healthcare team dynamic. What we do seek is to practice to the full extent of our license, education, and training. Nurse practitioners are advanced practice registered nurses who often have master's and also doctoral degrees. They have extensive training in diagnosing and managing common and complex medical diagnoses. Under the current law, NPs must have 5 years or more to practice autonomously. Requiring this written practice with team-based care and collaboration is already a cornerstone and a standard of practice in NP care. And it unnecessarily ties our state's capacity to use NPs to meet the care needs to supply and availability of rapidly declining physician workforce. In addition, the studies have shown that they restrict practice are more likely to have geographic health disparities, higher chronic burden of diseases, primary care shortages, higher cost of care, and lower standings of national health rankings. Now is the time to provide certainty and commitment to increasing mental and physical healthcare access to the citizens of the Commonwealth. I ask you to support the passing of House Bill 2183, and thank you all for your commitment and service to improving the health, welfare, and institutes of the Old Dominion. Thanks.
Thank you.
Mr. Chairman.
Delegate Orr.
Question of the presenter, ma'am, if you could remain a second. Thank you for all you do, let me begin, but
Yes, sir.
given Governor Northam's executive action, can you tell us how many nurse practitioners transitioned because of the 2-year change, or no?
I don't think that, to my recollection, that was not necessarily counted, but I will tell you that since 2021, we have increased by more than 1,000 of people that applied for practice. So I don't know the exact answer, but there was an increase, and I don't know if that was, documented or researched.
Thank you.
You're welcome. Any other
Okay.
questions?
No.
Okay, thank you.
Next presenter. Step forward, please.
Thank you, committee members. Thank you, Delegate Robinson. I'm Shelley Smith, and I've been a licensed nurse practitioner in the Commonwealth for the last 20 years. I've been a faculty member at a university here, educating advanced practice nurses for greater than 10 years. Virginia ranks 39th in access to mental health services and continues to struggle with primary care access. We are in a workforce retention crisis. Yet, despite that, our state continues to decrease entry into the workforce by placing arbitrary constraints on NP licensing. We continue to be an outlier. We are one of 2 states in the union that have a joint board governance over the regulation of advanced nursing practice. We have the longest transitional period in the United States. In fact, many states do not require any transitional period, as full practice authority is endorsed by many national leaders, including the Federal Trade Commission, the National Governors Association, the National Academy of Medicine. Our highly qualified NPs can leave Virginia to go to bordering states such as Maryland, where they can practice more expeditiously and with less red tape. This bill does not change nurse practitioners' scope of practice, but rather helps to modernize our outdated regulations to get us just a little bit closer to the national standard. I hope you will put the turf wars associated with this kind of thing aside and support this bill to help give Virginians the access to care that they need. Numerous studies, including our own state data, tells us that nurse practitioners are the most likely providers of care to vulnerable populations. So supporting this bill helps bolster their workforce in an efficient manner to improve health equity. Thank you.
Thank you very much. Next, if we could bear in mind the time factor, if you could keep your comments to about 2 minutes or less, that would help us to move through so that everybody gets a chance to hear.
Mr. Chairman.
Yes, sir.
Americans for Prosperity, Ben Knotts, we support the bill.
Morning, Chairman Walker, members of the committee. My name is James Williams. I'm Deputy Secretary of Health and Human Resources. I'm here to testify on this bill on behalf of the Governor's Office. He strongly supports this bill. The reason being, our behavioral health system in particular is under enormous pressure. We have vacancy rates in some of our facilities in the neighborhood of 25%. We have some CSBs that haven't had full hours because they don't have the type of psychiatric staff who actually can fully staff the facilities, including the Highland CSB that just recently opened a crisis receiving center. So I would just highlight that our behavioral health system needs more staff. We are also putting in $5 million into the budget for loan repayment just for psychiatric nurse practitioners because we need so many more of them in Virginia. So I would just also highlight, I think that about 20 states don't require any transition time. And so, we would really ask that this committee consider this bill to help our behavioral health system so that we can staff and get the people the care that they need right now. Thank you.
Thank you. Next.
Good morning. I'm Ashley Apple. I'm a family nurse practitioner. I have a doctorate in my field. I'm a nurse educator. I'm the Commissioner on Government Relations for the Virginia Nurses Association. We represent the interests of over 119,000 registered nurses in the Commonwealth. The quality and safety of NP practice has been demonstrated by an overwhelming volume of empirical data that literally spans decades. So I'd instead like you to consider now what a collaborative practice agreement actually does. In Virginia, a physician can collaborate with 6 to up to 10 nurse practitioners, perform as little as 1 medical record review per year, is not required to be on the premises where care is being delivered, can charge any amount of money they wish to enter into the practice agreement. It's not a residency, and there's no evidence to support that prolonged collaborative practice agreements or practice agreements, period, improve patient safety. There is evidence to support that it actually impedes access to high-quality care, particularly in vulnerable populations. So for the benefit of patients in the Commonwealth, we do ask that you support this bill. Thank you.
Thank you.
Good morning, Mr. Chairman. Julie Dime with the Virginia Hospital and Healthcare Association. I'm here to support the bill. I believe you have a substitute. I'm not sure if that was moved yet, moving from 0 to 2 years. We were uncomfortable with 0, but I believe with working with the patron that it is now 2 years in the substitute. To just confirm that, and we do support if it is 2 years.
Thank you. Anybody else here to speak in favor of this bill? Anybody here to speak in opposition to the bill if you come forward? And I think we do have one person by Zoom, but we'll hear the testimony of those here first. Go ahead, proceed, sir.
Good morning, Chairman and members of the committee. My name is Jesus Lizar-Saburu. I'm a family physician representing the family physicians. You have heard the term scope of practice used quite a bit. What you haven't heard is what is the practice about. And when you think about it, they're practicing medicine. It's the scope of practice of medicine. Nobody uses that word, and I think it's very key and important because it really reflects the difference in training. You're going to have providers that have never stepped foot in medical school. The quality of training is different. We, as an association, worry about our patients and want to put them first. We had an agreement to go to 5 years. We thought that was a good compromise for our patients, and yet we keep seeing the line in the sand move back and back and back. I urge you to think about our patients. This is not about competition. And yes, we want to meet the needs of the state, but I think by changing things like telemedicine and reimbursement, we'll be able to serve a lot more patients in our Commonwealth with the physicians that they need as part of the leading team. Thank you.
Thank you.
Good morning. My name is Elizabeth Ranson, and I'm a second-year medical student at VCU School of Medicine. My medical school classmates and I are concerned that HB 2183 is legislation that will create an imbalance between clinicians. Medical school has already taught me that there's a vast world of medicine to learn. I went to medical school because I want to help people. I grew up in rural Matthews County, and I saw the impact of low access to medical care. But rural patients deserve the same quality health care as those in more affluent areas. We deserve clinicians who have seen the most expansive scope of cases during their supervised training that best prepares them for independent practice. This proposed reduction in years of experience creates a significant discrepancy in clinical education and training between physicians and nurse practitioners. Physicians are required to complete a 4-year bachelor's degree and 4 years of in-person medical education to receive their MD or DO degree. They then complete at least 3 up to 7 years of residency, which includes 12,000 to 16,000 hours of supervised clinical experience and patient contact. In contrast, nurse practitioners must first be an RN and then enter a graduate level nursing program that can last between 2 to 4 years. These programs can be completed online, and curriculums can vary from state to state. HB 2183 begs the question, what requirements does Virginia want to ask of future clinicians before they can practice medicine on their own? HB 2183 would make those requirements drastically different between physicians and nurse practitioners. Therefore, I must ask that you vote no on HB 2183. Thank you.
Thank you. Next.
I got this. Um, Good morning. I'm Dr. Harry Gawanter. I'm the current president of the Medical Society of Virginia. I'm a trained pediatric rheumatologist here in Richmond and practiced for over 40 years. I'm here to express the physicians' community's concern with 2183. By permanently decreasing the number of years of clinical supervision as part of a physician-led healthcare team, required a nurse practitioner to go out on their own practice and practice autonomously, I do not think is in our best interest. Established in 2018, the current 5-year standard for NPs was not an arbitrary number. The number was an agreement between the MSV and the nursing associations, because 5 years is the equivalent of the years of clinical training for MDs and DOs to perform through their residency after attending medical school. The idea was that we would standardize the practice of practicing medicine on your own in Virginia, and it should apply the same to all healthcare provisions. I think one of the things that is most important in all this is you cannot teach experience. There are things that you don't know when you come out of school, and you need to learn that and be supervised to limit your errors, quite frankly, and we know that those occur. I trained in Rochester, New York. This was the home of the training for nurse practitioners throughout the country, one of the initial programs. I've worked with them my entire career. And ones that come out of school, just like doctors who come right out of school, are not ready to practice autonomously. It applies equally to both physicians and nurse practitioners. So I think that we need more nurse practitioners. We need more PAs. We need more pharmacists. We need more nurses, dentists, and doctors. This bill does not bring or create new providers. It just changes the rules for different clinicians who may solely be responsible for health care. As Ms. Ranson said, those in rural areas who are trying to increase access deserve the most experienced clinicians, not the least experienced, because they are facing the biggest challenges when they practice on their own. So we deeply respect our nurse practitioner colleagues, and we value their work for patients. But with this in mind, we ask you to oppose House Bill 2183. And I'm happy to answer any questions.
Thank you. Okay, if not, I think we have some by Zoom. If that could be opened up, is it Dr. Caroline Cox? Dr. Cox?
Hi, I'm Dr. Cox,
please.
speaking for the Virginia College of Emergency Physicians. I'm from Roanoke, Virginia, which is in the underserved Southwest Virginia. And our healthcare system is overwhelmed. Our ER is overfull, and we struggle to provide good care for patients in these crisis times. Adding nurse practitioners with no experience will make the problem worse. There's a recent study released from the Veterans Health Administration studying 1 million veterans who nurse practitioners have independent practice authority. And they found that when those patients come to the ER, if they're seen by a nurse practitioner, their length of stay is 11% longer. Their costs are 7% higher, and they have a 20% increase in readmissions to the hospital. This is because when it comes to emergency care and the care keeping patients out of our overwhelmed hospitals, experience matters. Emergency physicians have over 10,000 hours taking care of patients before they do it independently. Nurse practitioner school may only require 500 hours of shadowing before they can then go out on their own, and that's not enough. Medical students in their 4th year have over 2,000 hours of clinical experience, but they're not allowed to practice independently until they've completed a residency, which is 8,000 to 12,000 hours more. Experience matters. When your loved ones are sickest and when our hospitals are overwhelmed, we need experienced people taking care of those patients. I am very proud in my career as an educator of both residents, nurse practitioners, and PAs to have taught them all and worked closely with them all. And they're all outstanding clinicians who have important roles in our medical system. But right now, sending untrained nurse practitioners out to practice independently is adding fuel to the fire in our melting down healthcare system. We stand against this bill.
Thank you, Dr. Cox. Is there anybody else by Zoom, Madam Clerk? Okay. Delegate Robinson?
Well, Mr. Chairman,
Oh, I'm sorry, is there any questions?
if I may, so we have things in the proper posture, I move the adoption of the substitute.
Okay. So move in second. You may proceed.
Thank you.
Do we have copies of the substitute yet? Okay.
So.
Delegate Robinson?
So you've heard testimony from a lot of different places. In the last testimony that stated how patients were going to be harmed in the hospital, but yeah, you heard the Hospital Association stand up and said they support this bill. In relationship to New York, New York has no supervision requirements right out of the gate. A nurse practitioner, once completing their program, can begin to see patients. So times have changed. People, states are realizing that care and their training is what it should be. Nurse practitioners, their training is direct practice. Shadowing is forbidden by the Board of Nursing in the Commonwealth. So they are well-trained individuals. They have been trained. They have studied. They're 2 years. They're going to be working in collaboration with the physicians through their training. Let's allow professions to do what they're trained to do. These are well-trained, well-educated people. For rural areas, I know during the pandemic, there was a clinic out in New Kent that was you only had a nurse practitioner on site the entire time, pretty much that they were open for hours. These people are quite capable of doing their job, and these doctors of nursing deserve our consideration and let them get out to the public. You heard the statements about behavioral health we know that that's a huge area. We're passing legislation to improve care in the behavioral health realm. And I think the study showed from 2021, that ended in 2021, that 14%, I think it was, somewhere between 11 and 14%, sorry if I don't have my number right in front of me, their specialty is behavioral health that are coming out. So I think we can really fill some gaps by allowing this to happen sooner. I also have heard the statistics that somewhere be only 2 to 3% of nurse practitioners left their current working environments once they were able to practice autonomously. It's a very small number that chose to go out and open a practice on their own. They're still working in hospitals, in doctors' offices, in that direct collaborative patient team care environment. So I would hope that the subcommittee here would entertain passing this bill forward. Excuse me. A slip of the tongue. Whoops. All right. Yeah. So I hope we can report this out.
Thank you, Delegate Robinson.
Mr. Chairman?
Mr. Chair.
Oh, go ahead.
Oh, I'm sorry. Who was?
Mr. Chair, I would like to speak to the bill, and I have a motion at the appropriate time.
Proceed.
Thank you. Mr. Chair, I think that Delegate Robinson has put forward a substitute lowering the requirement from 5 years to 2 years. I think that is very reasonable. Particularly, we just went through the pandemic where the requirement was at 2 years, and we have not seen or heard through news or through other reports of a reduction in the quality of care provided by nurse practitioners with the 2-year experience. I think that's really important. What the pandemic has shown us is that the way we've done business prior and how we lived our lives have considerably changed, and some of those changes are things that we should continue to embrace because it helps us to provide additional care and high-quality care. I think that it is important to note that in so many of our personal lives, when we do see nurse practitioners, and I've shared this story before, I have 5 children. I go to the pediatrician a million times a year, trust me. And I love our pediatrician, but when I see our nurse practitioner, and I know that she's under one of these agreements because, frankly, the invoice comes to the doctor listed and not under her name, I don't get a call back to make sure that my child received appropriate care, that my child is still alive and breathing and well. And I know that there is trust between that physician and the nurse practitioner that she is providing the best care possible. And we need to make sure that that trust continues and that we allow, based on the experience in the pandemic, showing the high level of care that is provided, that we are able to expand healthcare in Virginia. We see a huge cry and need. And at the appropriate time, I'd like to make a motion to move this bill to report it.
Thank you, Delegate Tran. Is there any other questions among the committee? All right, we move to.
Is there a second term?
I'm sorry, was there a second? Delegate Hayes seconds? Okay. We have a motion and a second before us.
Mr. Chairman.
Yes.
Speaking to the motion.
Proceed.
Mr. Chairman, I want to start off by commending the patron. I know where her heart is, and similarly to the folks who spoke on both sides of this issue, because you both feel that you're speaking in what's the best interest of the patients of the Commonwealth. And, Mr. Chairman, therein comes my dilemma. One of my frustrations through all the years that I've been down here is when these matters come before us and we have folks who have dedicated their lives to serving the public health needs of the citizenry, but they disagree on how to best achieve that end. In my personal world, and the lobbyists are going to gasp when I make this suggestion because it would put a lot of them out of business, is I would think this is a matter that we would put a minimum number of hours in code, say 9,000, because that would be comparable to the current. I'm not proposing this. I'm dreaming, okay? And then leave it to the regulatory bodies where all the medical professionals weigh in and through the regulatory process adjust those if it needs to go lower, and that's what's, and that makes it more able to address changing needs within the medical field. And that's, I'm saying that not just on this bill, but on almost all these medical scope of practice measures, because we're not the experts. We try our best in representing our districts and representing all the citizenry of the Commonwealth. I commend the substitute that you brought before us. It's a lot better than nothing, and that's where you were taking it in the first place. I think you knew at the time you put it in, as you commented, you knew it was a bridge too far. I'm not there where you want me to be on this measure right now, and in large measure because we've got both sides of this equation who feel they're right. And I don't want to say either side is wrong, because they have both dedicated their lives to serving in their minds what's in the best interest of the citizenry of the Commonwealth. Thank you.
Thank you, Delegate. Or any other questions among the committee? All right, so we had a motion and a second, and this was with the amendment, Delegate Tran? Yes. Yes, okay. All right, if you'd indicate the pleasure of your votes on the board, please. So the bill before us fails on a vote of 2 favor, 3 against. I'm sorry?
She can vote. My bad. My bad, yes.
Was Ms. Robertson, Delegate Robertson, you indicate your vote. All right, so the vote now, for the record, is 3 in favor, 3 against, and fails. All right. Next bill before us is HB 2232, Delegate Murphy. Thank you, Delegate Robertson.
Thank you.
Yes.